Right. Hello everybody and welcome back to our channel. We're in a very giggly mood. So it's Christabel and Norafiah, and this is video number 4. And if you missed last week's video, we talked, it was woohoo, you're pregnant, and we talked a little bit about choices for your antenatal care. And we were talking a bit about first trimester, how big the baby is, and
some common ailments,
which we're going to follow on with today. Just a little medical disclaimer, we are not giving you medical advice that is specific to you guys, so use your own filters if you think it doesn't really gel with you. Also chat with your own healthcare professionals and providers to make sure that what we're telling you fits for you, your medical history, your family. We're just giving you some talking points and thinking points, really. So this isn't medical advice here. And so last time we talked about sort of how big the baby was, and we touched a little bit on common ailments. And so we wanted to follow on because a lot of them from first trimester are similar to the second. So commonly morning sickness, which we talked a little bit about last time.
And some women can have it quite worse. So normal morning sickness, you know, you're not able to keep food down, or maybe the smell of food, cooking or whatever can
a lot of people can't handle being in the kitchen or where the food is prepared.
And you can have either severe vomiting or just like really bad nausea without anything coming up. So it's important to stay hydrated.
Very important.
And eating small meals and just watching or knowing what the triggers are.
A couple of tips I always say to women is eat small meals little and often. So they say to eat like 5 to 6 times a day, which suits me because I'm a bit of a grazer. But that just means that you don't feel as sick and actually throw up if you're eating little and often. And then often just take your time eating. If you eat in a rush, you're more likely to feel sick. A couple of things that are very, very good. So some women like to go very natural with treating morning sickness. Would you agree? And natural remedies are things like B6 vitamins.
Complex B vitamins.
Ginger is amazing. And a couple of tricks of how you could, because people are like, ginger? What am I going to do with ginger? How do I eat ginger? So I've got some ideas. Okay, are you ready for them, Norafiah? I'm so proud of myself here. Ginger biscuits. Crystallized ginger. Ginger ale or ginger beer. A bit of Bundaberg. Shout out Bundaberg. I love you. And I've got how you could make your own ginger cordial. So you actually get a large crushed ginger root and simmer it in 2 cups of water for 20 minutes. And then strain it, obviously, to get rid of the ginger. And then if you add a tablespoon of raw honey and pop it in the fridge, it's a cordial that you can mix with water and drink through the day to keep hydrated, but also the ginger will not make you feel as sick. So that's my Christabel's top trick. Turns out I am a
Somebody
cook.
try that.
And let us know if it tastes good, because I've just made this up in my head. And people often ask me, how long is this going to go on for? Most times it settles by week 12. But 20% of women, unfortunately, do have it all through the pregnancy. So that's unfortunately bad luck, but not abnormal.
It's abnormal if you can't stay hydrated, so you can't keep anything down. And you do start to lose weight, because then that can affect the baby. So in that case, normally you would probably see your care provider, who will probably recommend you go into the hospital, and they normally just give you some more IV fluids and just keep you hydrated. And then
I always say to women, if you are really, really struggling, if you can't even keep fluids down, you must see your healthcare provider, because they'll assess you and give you the options. It might not necessarily be hospital, so don't freak out, but it's best to touch base. And sometimes women use anti-sickness tablets, and there's a range of them that are considered to be generally safe in pregnancy. So the main thing is, don't struggle at home just with my ginger cordial. If it's not working, come in, have a convo, and we'll talk about all the different ways we can manage that. Other things that you might expect ailment-wise?
The growing pains or ligament pains, so as your tummy starts to stretch and get bigger, and just with the hormones in pregnancy like relaxin and progesterone, it does what it says, relaxin, it relaxes everything. So everything's stretching and growing, so you can get, and particularly if it's subsequent pregnancies, and say you haven't had any body work, as in like going to chiro or physio afterwards, you may find that you are in a little bit of a misalignment. So I always recommend women after pregnancy or after they've given birth to go and get an adjustment or see a body worker, or otherwise you could benefit from seeing, say, a chiropractor or even physio.
Yeah. So if you're getting pain like that, it's often normal, but come in and have a convo and we can look at lots of options.
Yeah.
And the other thing we didn't talk about last time is screening.
Yep.
Or at least I can't remember if we did. We talk a lot.
We do.
So sometimes we don't remember.
Away, so.
But there's lots of screening through pregnancy. So it starts off just with basic bloods when you come in and you say you're pregnant, and that's to look at hepatitis and iron levels and blood groups and things like that. But sorry,
I was going to say, and with that, so a lot. I mean, the booking screens or the booking bloods, what they call it, is very routine that we do here in Perth or Australia. But just be aware that it's your choice.
Yeah.
And so you really need to know your own health.
Yeah.
So if there's anything, in the screening that potentially may cause a bit of issue,
or you don't want to do it, you don't have to.
Yeah, but it's important to have a discussion with your care provider, and so then you're well aware of what will happen with the results. If you do it and you get the results and it's like, oh, what do I do with this now?
Yeah. So the bloods are mainly basic ones to check if there's anything we need to know about as you progress through the pregnancy.
Yeah.
Then we ramp up some of the screening, and it's offered to people to have an ultrasound and blood test screening for things like Down syndrome or other chromosomal problems. Obviously, this next bit we're talking about is probably more specific to Perth. There'll be different guidelines where you are in the world, assuming we've made it out of Perth or Rockingham. But normally you'd be offered a blood test around 10 weeks and an ultrasound at 12. In Perth, that's not covered in most circumstances by Medicare, so there is a gap of payment that if you decide to do it. So there's lots of things to think about and talk about with your family and your partner and your doctor to see whether you're at risk, how much risk, and whether you want to do the test. So the ultrasound and the blood test doesn't give you a definitive, it just gives you an idea or a risk.
And that is an important note to make. It is just a screening tool, so you really have to, if you come back, say, as a high risk, particularly for the Downs, then there is another more definitive but more invasive test. So just because you come back with a high positive, it doesn't necessarily mean, that the baby has got some chromosomal abnormalities. But it just means you'll be counselled,
to look at whether you want to do the test. So a lot of women's things they're thinking about at this stage, about particularly whether they want to do this ultrasound blood screen, things I say is, would it change your decision of whether to carry on with the pregnancy? Because that's a big one. If it would, then you'd be more inclined to do it. Sometimes women are very strong, feel very strongly that it wouldn't change their mind, but some women would like to know beforehand. So
then they can get information
and be prepared for it. So there's lots of things to discuss, but that screening in Perth is not covered by Medicare under most circumstances. So there's a small, at the moment I think it's about $110 to get the ultrasound. So something to bear in mind for screening. And that's it really for screening in the first and second trimester, isn't it?
Just mainly the bloods, the ultrasound.
And the GTT is in the third, isn't it?
In the second.
Oh, second. So we should. So actually, and the GTT is a glucose tolerance test, which is for women that have had to do it before. I haven't had to, but I just see the women and feel sorry for them because it's drinking a very sugary drink, sitting here and then getting your bloods tested, and it is checking for diabetes. So it is standard practice in Perth where we are to offer that to women, but it is a choice.
It is
so
a choice,
have a discussion about it. The reason we're bothered about checking for diabetes in pregnancy is women with diabetes tend to have bigger babies, and that can sometimes affect delivery options and things like that.
Yeah, exactly. So it is a bit of so in midwifery it is a bit of a topic, gestational diabetes, and in particular the glucose tolerance test. So really speak with your care provider. Think about the benefit that it's going to have to you. Also think about not just the test in terms of the pregnancy progressing and the effect on the baby, but also the implication for labour and birth, and then also afterwards as well, because there are certain blood tests, etc., that the baby is also subjected to, and a lot of women, well, you know, some women that I've come across, they weren't aware of that, and it can just be a little bit confronting.
So the glucose tolerance test is something also to think about whether you want to do, and there are no musts in pregnancy.
No.
So you don't have to do it.
No, that's right. So the tests are not mandatory, but it's up to you to have a discussion with your care provider and decide whether it's going to be beneficial to you or not.
Yeah, perfect. So how big is the baby now? Because we did that last week.
We did.
And the baby looked like an egg.
Yes.
Right?
Yeah.
An egg or some grapes or something random like that.
Exactly. So at the moment, 13 to 28 weeks, so 25 to 30 centimetres long by the end of the second trimester. Yeah, it's covered in vernix, so that's that the waxy looking stuff, because it just kind of helps protect the baby inside, because the baby's swimming in water.
Protects their skin, like if we've been swimming for too long, you know, or you've been in a bath for too long. Yeah, your skin gets funny, so that's what the baby's vernix does.
Yeah. And then at this point, you'll probably start to feel the baby move. So initially, women feel it as flutterings, or they describe it as like popcorn inside, which I thought was really good.
I'd rather the edible form myself, but hang on.
And babies also can start to hiccup at this stage as well. Yeah, so it's just, and that's to do with their fetal lungs.
You wouldn't hear that though, would you?
No, you wouldn't hear it, but you know the mums can feel it.
Oh, really?
Yeah.
That's like the popcorn again?
No.
Oh, okay.
That's just the movements.
Oh, okay.
Yeah.
This is why you need a midwife and a doctor, because there are some things I just don't know. Perfect. So the only other question that I get asked a lot around this stage, and is something to think about, is exercise, because a lot of women
can I just go back to the baby movements? Just one important note. So baby movements, so when you start feeling baby movements, just be aware of your baby's own movement patterns. So generally most babies are really active at night, or first thing in the morning. After you've had something to eat. So it's important that you actually get to know your own baby's unique movement patterns. Okay, so I know there are things out there like, you know, your baby should be moving like 10 times in an hour or whatever, but sometimes I think if you try to put too many numbers or things like that prescriptively,
it's just confusing.
It's confusing. So I just say feel for the baby's movements. And really tune into the baby, get to know the baby. So then, in the times when you know you are really busy and you're not really aware, or you haven't felt baby move, you can just kind of tune in and just kind of say, well, is this the time when the baby normally moves?
Yeah, because this is something you get asked a lot as you ramp up antenatal appointments. At every appointment, a midwife or doctor would say, "How's the baby moving?" Moving. And it's sometimes can be a sign that the baby's struggling. You know, if there's any complications. So it's good to know what's normal for your baby and you, so that if there's a problem, you can go, hang on, actually baby would have moved a little bit more, or actually this is very normal for my baby. So that's why it's a really good tip to learn early on what the pattern is.
So then it's less stressful for you as well.
Cool. And so then the only other thing I've got to say is exercise. So I have two lots of women. I have women that either do not exercise at all and just eat for two through the whole pregnancy, and that's normally the first time mums actually. They do that a lot, and then they go, oh, it was really hard to lose that baby weight. Maybe that wasn't the cleverest thing to do. So with exercise, it is safe to exercise during pregnancy. That you just have to take some considerations into what you do. The thing I always say is, if you didn't exercise before, don't suddenly start doing aerobics classes every day, because that's too much. So don't go from nothing to strenuous. If
start
you
slow.
Aim for 15 minutes every couple of days and ramp it up. 30 minutes every day would be a good amount, and actually has a lot of benefits, because having the baby, the labour, is hard work. I haven't done it, but I've heard it's hard work. So if you've exercised and had tolerance, that's actually going to be quite good for your heart pumping and stuff like that. So we would recommend exercising. Just make sure if you're doing an aerobics class or something that you tell the instructor that you were pregnant, so they can moderate certain activities, that you do as your body feels. So if you feel it's too much.
Yeah, low impact. So low impact stuff. So I always say pregnancy yoga, start pregnancy yoga. Walking is just an always good overall standard, isn't it? Walking. Aqua aerobics. Is another good one.
And I've got as well, avoid exercising in really extreme hot weather, and that's an important point for Perth, particularly. We get some very hot summers. You just have to be extra careful doing really strenuous things because you often will not get enough fluid. So just be a little bit mindful of that if you're exercising really outside in really hot weather.
Yeah, absolutely.
Top up. And there are some things that we recommend you don't do. So swimming and yoga and a bit of aerobics, Pilates, all of that, amazing. Walking, nothing like a bit of fresh air. Things that you shouldn't do. Scuba diving. I would have thought that was a given. I don't know many women who are doing scuba diving, but don't do that. Rugby would be high impact tackling. Don't do that. Gymnastics, anything downhill. Essentially, anything that might cause harm to you or the baby. And I think it's really common, obvious things that you might fall down in and things like that. And also avoid saunas. That's very important. But generally, we would recommend you do a little bit of exercise.
Yeah, definitely.
So that's very, very good for the pregnancy.
Yeah, definitely. So, and always listen to your body. So as you get bigger, I mean, if you, start to get too tired, sometimes, one, it could be that you're overdoing it, or the other thing is you could be low in iron as well. So it's usually around the second trimester, isn't it, that around about the 28 weeks is when we do another screening for bloods and we check women's iron levels. And full blood count. And usually if you're already starting to feeling a bit wishy-washy, you're not sleeping very well, and sometimes, some women do come in, they look quite pale, and it's a sure sign that it's iron.
It's often iron.
So try to increase that in your diet. And then
dragon fruits are really, 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 that's my big tip for iron. So everyone just says, oh, well, I don't really like eating steak. Yes, you get a lot of iron from steak, but you can get it from lots of vegetables. But dragon fruit is amazing. So when we had Ibu Robin Lim come and speak, she is an amazing midwife in Indonesia. And she uses dragon fruit with the Balinese women because it's plentiful there and it's cheaper than red meat. So what I always say is dragon fruit is delicious, but if you struggle to eat a whole fruit or eat loads, chuck it in a smoothie. Amazing. And if you can put some kale in there,
beetroot,
broccoli, spinach, that will all increase your iron. So dragon fruit, top tip.
Good.
Perfect. Well, I think that's it for this video. Is it? Unless
weight gain.
Sorry, weight gain.
Which
that's important. Ladies, listen up.
But the weight gain, so you will gradually start to put on weight. So don't stress about it, okay? You're supposed to, and just a bit of statistics stuff. So the weight of the baby is usually around about 38 to 40% of your weight gain. The placenta is about 9-10%.
That's quite a lot, isn't it?
Yeah. And then you've got amniotic fluid, and then you've got the weight of the uterus, your breasts. Oh, because you'll probably find that your breasts
it's like a free boob enlargement.
And then also blood volume, because women produce extra blood volume.
So that's why actually the iron tends to be an issue around this point, because you've got more blood. Yeah,
exactly. And then just some of the other changes to your body. So your skin will darken around the nipples, around the areola will darken. Some women get that linea nigra, they call it. So the line from your belly button.
Like a dark, sort of hyper-pigmented line.
Yeah, that's right. And what else? Oh, they can get patches, and it's just because of the hormones. You can get like what they call it, the mask of pregnancy, I think. And also some swelling and in your hands or feet. And stretch marks. That's sort of quite a common changes well to the body.
Get your stretch mark creams on. Bio oil, all that jazz.
Collagen. Also, probably UTIs. Some women can be quite prone to UTIs.
So that's a urine infection.
That's urine infection, because your immunity is depressed anyway. Right? You've got low levels of immunity because, you're accommodating another human being inside of you. So, lots of water. Cranberry.
Cranberry's brilliant.
What else?
That's pretty
much it, really. But probiotics is a really good thing.
And we would say, if you think you've got a urine infection, let your midwife know, because we don't want infections to go on too long or get untreated, especially when you're pregnant. So when you're not pregnant, you can maybe afford to be a little bit lax with it, but we take them a little bit more seriously in pregnancy just because we want to get them sorted quickly. So it's best to just get the advice of a health professional.
Yeah.
Early.
Yeah. And then for women who are rhesus negative, so usually at around about the 28 weeks in the second trimester, you'll be offered your first shot of anti-D.
And what is that for people who don't know? Like, why are we doing it?
Well, so women who are rhesus negative, so if you don't know whether your partner is a negative blood group, so potentially they could be a positive blood group, what the mum's body can do is develop antibodies. So it won't necessarily affect this pregnancy or this baby, but it's more about the next baby. Pregnancy. That's right, because what the antibodies does is basically go, oh, this is foreign cells inside my body.
I'm trying to attack it.
I'm going to attack it. Yeah. That's right. So if you are rhesus negative, normally they will offer the anti-D, the first one at 28 weeks.
Yes.
And for even any other woman as well, if you suffer a fall or any kind of event where there is a potential risk of bleeding and a crossing of blood between mother and baby, then obviously they take the blood test in that first, but then they would also offer the anti-D. Yeah.
Perfect. So that's about anti-D. And was there anything else you've got, Norafiah?
No, I think that's about it for the second trimester.
So next week we're going to talk about the third trimester. So again, how big the baby is, some common ailments, and then we'll start to ramp up and talk about labour a little bit as well.
Yeah. So at this point, like, enjoy your pregnancy, and you're probably just getting your head around the fact and
before you get too big as well.
Exactly. And I guess the main thing with the second trimester is just like taking care of your physical needs, isn't it?
Yeah.
Like, you're eating well,
exercising, keeping hydrated, drinking that ginger cordial, chucking some dragon fruit in it for a little bit of iron,
connecting with baby because his body's starting to move now. So
learning baby movements. So that's all the fun stuff. Second trimester, really. First trimester is, oh no, what have I done?
That's right.
Third trimester is, oh god, a baby is going to come out of my vagina. Pretty much.
That could be really good heading for the next.
Oh, there we go. There's a title. Oh my god, a baby's coming out of my vagina. Okay, guys, that's it from us. Thank you very much for watching. Don't forget to subscribe, and we'll see you all next Tuesday.
Yeah.
Bye-bye.